Hello everyone, I'm Dr. Francisco. I'm alive in Facebook once more. This is my clinic. Let's go in so I can take the mask and then I can talk to you. So welcome to my clinic. Today happened to be that Facebook reminded me that the third anniversary of my clinic, Francisco Medical Center, as you can see there, has occurred this month. So it's time to celebrate because it had been 3 years. Probably let's go inside the clinic, there is a better lighting. I was not prepared, so that's why I don't have the stand. Just to introduce you to my clinic, this is the reception. There's one extra room there. All the walls are decorated by beautiful pictures of my children. This is the main room. But anyway, I'm just giving you a quick tour. And you can see my desks over there. Some posters, TV for presentations to explain things to my patients, my qualifications. You can see in the background, nice view, buildings in the area of Novena. And just to enhance the lighting, I'm going to just open a little bit the window here. Okay, so now I can probably just introduce you a little bit what has happened in this, maybe not the 3 years, but at least in the last year. So, as I mentioned, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Medical Center. That is this space that I just showed you. We started working 3 years ago in a different location, but we changed almost 2 years ago to this location. I see patients with any type of kidney problems, chronic kidney disease, diabetic kidney disease, polycystic kidney disease, glomerulonephritis, that is inflammation of the kidneys and express itself as protein or blood leaking in the urine. Also kidney stones and their prevention, urine infections, and total kidney failure, patients that need dialysis or a kidney transplant. But I also see kidney-related conditions like type 2 diabetes, high blood pressure, metabolic syndrome, excessive weight. I see patients that live in Singapore, Singaporeans, expats, but also foreign patients. With the COVID-19 situation, the number of foreign patients have decreased, but through telemedicine, my clinic provides telemedicine advice. I still keep in contact with my patients and give advice to them, especially that in many countries they are in lockdown. So the important thing about my clinic or myself as I practice medicine is that my medical care, my specialist and medical care is not purely disease-centric. Indeed, I treat medical conditions related to the kidney or associated, as I mentioned. I prescribe the same medications as any other kidney doctor, but I focus in the individual as a whole. I see what other aspects of the life of my patients or other conditions might need a little bit of mending or improvement. And then I give advice, diet, lifestyle, focusing individual as a whole for a more rounded health. In that case, the patient can get greater levels of physical, mental, and global well-being with less worries, less stress levels. That is actually very important. And indeed, probably better kidneys, better heart, and better whole body. Because I believe that prevention is always better than cure. And not only that, it's also cheaper and leads to less worries and can allow you to tackle complications earlier before it's maybe too late. So it's worth investing in prevention. So I always incite my patients to adopt a proactive, preventive, preemptive approach over just being reactive. I try not to be reactive just to problems, treating complications, and supporting disabilities. I want to be proactive, preemptive, and preventive so that we can catch at the earliest stage possible any disorder or any problem, so like we can solve it. But not only that, even that sometimes when there is no problem, I still give advice to my patients for health enhancement, for disease prevention, etc. Because that's what I would like to have in my life or the life of my loved ones. In addition, in the last year, I opened my other company called Olympulyzer by Dr. Francisco, in which I also help my clients and patients to enhance their health, to obtain sustainable, healthy weight loss, to control their diabetes more holistically through diet and, lifestyle modifications. If they are using medications, sometimes the medications can be minimized, or maybe controlling the diet, they don't need to be increased as soon as otherwise. Or sometimes the medications can be stopped with a good diet control and lifestyle. But also to promote a greater level of functional fitness for my patients. Some of them do sports, etc., but at least to have a more resilient body, a stronger cardiorespiratory system, to live longer and live better with less diseases as we all grow older. In the last year, there have been many changes because of the global situation with the COVID, but also in my clinic and also in my initiatives. I was a lot in Facebook, YouTube, promoting health. I created a Facebook group and a YouTube channel that we have already 53 live videos on kidney health and disease that you can watch, with the aim of just promoting health, promoting better care of the kidney for people that maybe are at lockdown and cannot get some of that advice from their own doctor. So I created that channel and that Facebook group 1 year ago. You can still watch it, and I also published an ebook based on those videos and has been welcomed by the local community, patients, doctors, dietitians, pharmacists, etc. So you can also check it out. I can leave probably all those links in the description after the end of this video. And I also have, for my other company, Facebook group and some health initiatives. I have given some health talks, one on the World Kidney Day, on how to live better or well with CKD. So I've been quite active on health promotion for, overall health or for kidney health, and having those initiatives, and those will carry on. I will carry on promoting this online. I will carry on providing medical services in my clinic, but I also will continue providing telemedicine for the people who might be at risk of maybe the vulnerable and doesn't want to travel, and sometimes the thing might be sortable through telemedicine, or for people who maybe my patients are in another country. So it's always better to get some advice than just remain there not knowing what can be done or what needs to be done, because that also can deter you from acting on time. As I told you, I'm always proactive, preventive, but also can build a lot of worries. So just in summary, this was an improvised video. I was just triggered by that post today in Facebook, reminded me that I've been 3 years here, and I just decided to introduce you my clinic again, and just say some words. Just in summary, have been 3 years. I'm still here providing care for any patient with kidney problems, kidney-related conditions like type 2 diabetes, also for health enhancement, weight loss, and functional fitness. And I will continue with all those initiatives in social media promoting health for kidney patients or for patients or for people that simply want to enhance their health and prevent this sort of chronic illness, or just want to live as best as possible. That I suppose is everyone. So I think that's all I wanted to say today. So I'm Dr. Francisco, wishing you the best possible health. Take care, guys. Bye-bye.